It's amazing to see the plans we had on paper come to fruition when this facility opened up in 2011.
They give you a lot of the tools you need. They gave us like bone bends and blood pressure cuffs.
We have state-of-the-art research and clinical grade laboratories that are integrated via an experiential learning model.
We have a simulation lab, which a lot of schools don't have.
We practice at the school for hands-on experience, and then we would go into the hospital and practice what we learned in the lab.
There are many positions that NCC graduates fill here in the organization. We realize how important this is really for the long-term success of NCC and for Norwalk Hospital to have a very deep relationship. We need to train the next generation of caregivers. It's important for both of us that we have to care for the community that we both serve. And from a hospital's perspective, it's really important because we can offer employment for those graduates of NCC.
We have opportunities for the NCC students to gain their professional experience here, from nursing to respiratory therapy. We actually have Norwalk Community College nurses in oncology, resource nurses. It really spans across our organization. And actually, one of the most important programs that I did want to mention is our GEMS program, and it's Graduates Engaged, Mastering, Succeeding. And it allows them to have a very prolonged transition into practice and to master their skills before they actually have to take care of patients by themselves. And it's been a wonderfully successful program.
I love being a part of the team here. I love being the chairperson here, and I love the department here. This department is really a student-first department.
I love the nursing program. I love the instructors. They have tough love with you, so they make sure that you're going to be a competent nurse.
I feel what they have to offer really sets us up to do quite well in our clinical experiences. We get a lot of hands-on.
Schools come in to look at our simulation lab. We have 5 mannequins that actually emulates patients in real life.
We've had like a pediatric sickle cell scenario where we go in and one of the students will volunteer to be the nurse and does the full assessment.
We can actually stream into a classroom where the student that's one-on-one with the mannequin can actually just be one-on-one with the mannequin. The teacher can actually be in the control room, and the other students are in the room where they're viewing the student, so that student doesn't get really nervous.
We're lucky enough to, mess around with the IVs, play with them, know how to start and stop them, know how to clean wounds. So it's really hands-on. Like you will learn your skills.
Stick this on your tongue, just hold on to it like that.
We have a great partnership with the students and with the college. And the college sends students here, and we have them rotate to our different departments. The students are very enthusiastic. They really want to do what they're doing, which you kind of have to do in this field, obviously. So they're great students. They're real knowledgeable. It's a great program. It's great because the area needs technicians. VCA is always looking for bright young technicians, or old, and it's a great partnership.
Our Wellness Center services our entire campus population. In addition to our students working in the Wellness Center to prepare for their roles as health fitness professionals, we also prepare our students for trajectory into clinical exercise physiology.
So he's coming up and he's going into a curl up, okay?
Thanks to the wonderful support of the NCC Foundation, we have state-of-the-art research and clinical grade laboratories that are integrated via an experiential learning model in every one of our exercise science courses. In addition to that, both myself and other faculty in the program conduct research in our laboratories.
Started college here in 2012, transferred to UNC Chapel Hill in 2015. Now I'm on the physical therapy track. Came back here to knock out some prereqs in the exercise science program. Having taken classes at a Tier 1 research institution, some post-bac classes at Ivy League institutions, I really think we rival their facilities. We do a college bowl with the American College of Sports Medicine every fall. We came in 4th place out of 18. We were the only community college there, so we can compete with the best of them.
This puppy part underneath.
I wanted a more in-depth career with more opportunity and came back for the PTA, Physical Therapist Assistant program. I have been able to work in wonderful environments and locations, very reputable neuro hospitals. I've worked with Olympians, Team USA, so this program has just opened doors for me I never imagined possible.
You're not just on one path with physical therapy. There's multiple different settings that you can kind of angle yourself toward. Even for myself, I did full-time 6 years at an inpatient acute hospital at Norwalk, and I'm also working at an outpatient place.
We take classes on the body, anatomy, kinesiology, all gearing us up to eventually move on to work at an outpatient clinic or, like I am right here, a subacute rehab. Today I have a whole caseload of patients that are basically mine, so it's exciting.
It's a lot of work, as it should be. It's healthcare, but that just makes you even more prepared for the field ahead.
If you can breathe, what else can you do? And that's what respiratory care provides. It's a very rewarding career, and you work with all kinds of patients, from babies to adults. I always said the time at NCC was the happiest of my life, and I miss that experience. The program is great. I got scholarships from the NCC Foundation, and for that I will be always grateful.
The program allowed us to go into 7 different hospitals, and we were able to learn the different aspects of respiratory. I started my bachelor's at Southern. After that, I started my master's program at Norwalk Community College.
Nobody beats Norwalk Community College, and I think many of our student alumni would attest to that statement.
The faculty is great, the students are great. The NCC Foundation is really our backbone to making sure that this all runs for us. It's a village of us that actually work together to make sure that students are successful, and our main thing is making sure our students are successful and making sure they have the resources they need to be successful.